In the sixth session of our series, we'll be learning about self-advocacy and self-determination as an evidence-based practice. We'll be joined by our presenters, Dr. Richard Chapman, Associate Director for Disability Leadership at Virginia Commonwealth University, and Dr. Jessica Shuttler, Child Psychologist and Assistant Professor at the University of Kansas Medical Center. Our learning objectives for today would like you to be able to define self-determination and its role in mental health outcomes, to identify evidence-based strategies that promote self-determination, use that to empower clients to make informed choices in therapy, and adapt therapeutic practices to support self-directed engagement. And then lastly, to be able to reflect on clinician beliefs and practices that impact client autonomy. So at this time, I'd like to invite Doctors Chapman and Shuttler to the stage.
Okay, everyone, good afternoon, and it is so happy to be here today. My name is Richard Chapman, and I am happy to be co-facilitating with Jessica. I'm a mental health counselor that specializes in disability leadership at the Partnership for People with Disabilities. I conduct research in the area of mental health counseling for persons with intellectual and developmental disabilities. I also have studied self-determination, intervention, and assessment, and I completed a postdoctoral fellowship at the University of Kansas Center on Disability. I'm a disability studies scholar, which means that I engage in advocacy and research on behalf of persons with disabilities. And for a fun fact about me, I'm a huge Star Wars fan. This is me as a Jedi. Um, yes, ChatGPT can do some amazing stuff. Um, question, um, what is wrong with this picture? Either you can unmute yourself or put it in the chat.
The lightsaber's a wrong color.
Yes, 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 yes. The lightsaber is the wrong color. I am a Jedi, but I'm holding a Sith lightsaber. So Jessica, why don't you introduce yourself?
Oh, wow. I'm just still processing this new Star Wars knowledge that I just gained from you all.
Yeah.
Um,
Yeah.
it's nice to be with you all. I wish I had a cool AI picture, but instead I have this one from probably 10 years ago when I first started in my role, which is as a psychologist and associate professor at KU Medical Center, which is in Kansas City. I also serve as the training director for the Kansas Leadership, Education, and Neurodevelopmental and Related Disabilities program. So I love the ECHO model of all teach and all learn. It really aligns, I think, with lots of things we're trying to do in our LEN training and other types of interdisciplinary training. I also work with the Kansas University Center on Disabilities, which is another way that Dr. Chapman and I began our work together. And similarly to Richard, I also am interested in strengths-based and person-centered approaches to psychotherapy. My work is housed in the Division of Developmental and Behavioral Sciences. So I work also with lots of teens and adolescents and young adults. So I'm interested in that kind of stage of life as well. and have been really interested over the last several years. And I'm here today to talk with you about the connections between self-determination and mental health. I am not as much of I would call myself a casual Star Wars fan in that I know about it and I'm starting to get into Andor, and I'm looking forward to this Mandalorian and Grogu movie that's coming out, but that's about as far as I can go with that. I definitely would have failed Richard's quiz about the.
Yes, yes. And you can tell I'm like a big joke. Um,
Oops, I think I missed. This is essentially what Dr. Buck already introduced to you. So we'll go on to this next slide and I'll turn it over to you, Richard, for this part.
yeah, so we normally like to start our training on self-determination by asking this simple question. What comes to mind when you hear the word self-determination? Just you could you mind look in the chat?
Yes, we have some themes of choosing choices, being able to make your own choices, making decisions for yourself, having autonomy, um, owning, having your own goals, making your own decisions, being an agent in my life, being the driver of your life, ability to make those goals. Lots of themes of choice, goal setting and pursuing, decision making, agency.
Yeah, a- absolutely, absolutely. All this is great. Okay. Okay. So we define self-determination using the definition of self-determination, which is found in causal agency theory, which is a theory of self-determination developed by Kelly Green and colleagues. And they define self-determination as being self-determinate means that acting or causing things or to happen as you set and work towards goals in your life. I have a colleague at the university um, at, at University of Arkansas, Dr. Shada Rayleigh says that self-determined people are CEOs of their own life. They also go, goal, goal chasers. They go after, they set and work towards goals. Next slide, please. And when we look at self-determination, and yes, that is a unicorn. We and don't it's that decide, act, and believe. You know, in the old days, we talked about big words like gentle action, volitional action, and action control beliefs. But this is really a simpler way to look at the component of self self determination. Um so in decide, individuals set personal self-directed goals is they reflect on their own preferences, values, desires, and emphasize goal autonomy and goal setting. At they take they are taking purposeful, goal-directed actions that involve problem solving, um, self-regulation, and persistence to achieve desired outcomes. Believe they maintain positive beliefs that they can actually accomplish their goals and 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 they can believe that they can actually set and make goals and actually accomplish their goals. Um, Next slide, please. And these are some when we look at self-determination skills and ability, um and we get a lot of this work from the self-determined model of instruction, which is the intervention model of self-determination. But these are self-determination skills and abilities: choice making, decision making, problem solving, goal setting and attainment, planning, self-advocacy and and self-awareness and self-knowledge. And and these are all critical components of self-determination. Jessica, is there anything that you want to... Well, yeah. What, I mean, just asking you, what would you benefit from going more, going, benefit from going in one or more of these areas?
Richard, I know you were asking me about like what I would add, but I would first agree to yes to your question that yes, I would certainly benefit from going more across these different areas. And I think when we think about broader well-being and promoting mental health for folks that we're working with and supporting, building and strengthening and supporting the development of these skills and abilities, we would argue could go a long way in supporting our clients in pursuing goals and feeling better about their navigation of the world. So that's
Yes.
why we've sort of kind of brought them together conceptually in some of our work, and that we wanted to talk with you about today in the context of psychotherapy.
And a related component of self-advocacy, of self-determination and self-advocacy is and self-advocacy is defined by a guy by the name of by David Test. He was at the University of North Carolina at Charlotte, and he defined self-advocacy as having a knowledge of self, a knowledge of your rights, the ability to communicate that knowledge and leadership skills. So this is how self-advocacy is defined. Next slide, please. So why is not only self-advocacy and self-determination important? The ability to speak up and set goals is very important. The Me Too movement, the rate of abuse for persons with disability is horrific, and we need to be able to have individuals with IDD speak up for themselves. Community integration, um, people to be need to be able to be integrated in the community, so they need to be able to have have self-advocacy and self-determination skills. Quality of life of the individual. We know that when people express a higher self-determination and self-advocacy, they have a increased quality of life. Um, we, and we also know there's a relationship between how physical and mental health and self 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 determination. And me and Jessica's book, we have hypothesized that when you increase self-determination, that would improve to a mental health, overall improvement in mental health well-being. Um, um,
I'm sorry, Richard.
yeah, no, I was about to say that slide, and I think
Okay.
this is you.
Okay, I did not want to cut you off before you were ready. So, we wanted to talk a little bit more too about why we think self-determination is important and why would it matter to us in mental health and in psychotherapy. And as Richard was mentioning and describing previously, we know that self-determination or this idea of developing as a causal agent or developing your causal agency is a considered a construct of positive psychology, right? So it's a strength that people can cultivate and can build to help them or to support them in making more of the things that they want to have happen in their life. And we know that this is an important type of positive protective factor that we want to especially think about if we're thinking about our clients who are people with intellectual disabilities, because we know when we have kind of studied rates of self-determination that people with intellectual disabilities are experiencing lower rates of self-determination characteristics than peers who do not experience disability or even than other peers with other disability experiences. And this is not because there is something inherently different about people with intellectual disabilities. It's really because of opportunities that people have had over their life to be able to practice and build and cultivate those skills. And so our argument here is that we think that the psychotherapy context is an excellent context in which we could support and cultivate and help to cultivate those characteristics in folks that we're working with, because it's also shown that self-determination has links to other important outcomes such as quality of life and thinking about the current research and the current literature that where we understand that people with intellectual disabilities are also at kind of higher likelihood of experiencing different types of mental health conditions. It seems all the more important that we should sort of connect with people at this intersection where we are not only trying to support and help folks to manage and cultivate mental health, but also to manage and support and cultivate self-determination. So we think that that really all comes together as things that would be important for us to be thinking about as the therapist community of how we're supporting in partnership with our clients, so with people that are coming to us in therapy. So, over the next few minutes, we wanted to share with you some of our suggestions for strategies to promote self-determination. So, we'll try to go through these with some clear examples, but also quickly to be mindful of time. We also wanted to just call out and let you know that Dr. Whitwer and Dr. Carey, colleagues from Ohio State, are putting together a much longer book that will have lots of great resources for supporting a lot of different things, including self-determination in the therapy context. And so we'd encourage you to follow up with us or follow up with the team for more resources around that. So we think some of the kind of key steps or strategies that folks can take in those psychotherapy connections with folks to promote self-determination starts with that idea that a lot of you started with when we first asked you about self-determination, which is this idea of promoting and centering the person seeking therapy as the decision maker in our therapy contexts. We want to ensure that for our therapeutic relationship, that for most folks, that the person who is there in therapy wants to be there, is interested in pursuing therapy, understands what the purposes and goals of therapy are, and is sitting in the driver's seat in terms of identifying goals that they want to pursue, and understands the role of how a therapist or other supportive others might be there to support them in pursuit of those goals, but to be really feeling like they are driving what's happening right at that that initial start of the initial conversation at the start of therapy. So really focusing on what sorts of things the person wants to pursue, what they're interested in cultivating more of, and also how they're best supported in doing that. What is the preferred or needed mode of communication that the person wants to do those pursuit in? What are the cultural values and beliefs that are at play for that person? How are they identifying themselves? How are we sure that we are establishing a good understanding of one another? We also wanted to introduce the concept to you of supported decision making. Hopefully that may sound familiar to some of you. Again, there's lots more resources available to pursue that outside of this conversation, but we wanted for folks to think about how we all have support, right, in making decisions that are important in our lives. And this is certainly true for people of all abilities. And supported decision making is a paradigm that really enables people to think about how they make decisions with support from trusted individuals and can be applied to a variety of contexts, including the therapy one, but is also one where we as therapists could provide that sort of education to our clients and their supporters as they're seeking therapy so that they are familiar with that approach and could utilize that approach as fits for them within the healthcare context or within other types of legal contexts. So that's an important concept to be aware of as you're kind of beginning this journey of promoting self-determination. We also want to be thoughtful and intentional in identifying strengths and values of our clients, of the people seeking therapy that we are working with. We can do that through some structured types of assessments like the values in action or VIA assessment. We might do that through value sorts or strength spotting types of activities, as well as targeted conversations where we ask about what's going well, what are 3 good things that are happening in your life right now, and let's start from there, and what successes you're finding and why, and how we can build from those strengths to make what you want to have happen more likely to happen in the future. Similarly, as we think about building that relationship and establishing that relationship, we then, as we are working together, want to adapt our therapeutic practices. And it really comes down to communication, getting to know one another, being flexible in our work together, understanding what supports are important and the support of others who maybe that person wants to have involved in their therapeutic process, as well as just to call out again this the self-determined learning model of instruction that Richard mentioned earlier. It's now transitioning to being called goal time, but it has one of the things we like about that structure is it has kind of structured suggestions around educational support. So things like considering how we might use visual supports, how we might use role play or video modeling, what types of communication support strategies might be important, what sorts of environmental supports or decision-making supports might be helpful, what sorts of strategies to reinforce myself, to encourage myself to try something new. All of these different types of supports are available within that model and we think are really intriguing to consider when applying to the therapeutic process and those therapeutic goal pursuits. I think the kind of last area that we wanted to think about with you is our beliefs and practices that we as clinicians want to be very mindful of, and that could be impactful to the autonomy of the person seeking therapy. So first of all, recognizing what are the characteristics of self-determination, what are tools that we can use to promote choice, to support goal setting, action planning, and sort of self-evaluation of progress towards those goals, and to recognize that we are all interdependent. So self-determination does not mean I am doing something entirely by myself. It does mean that I am making things happen in the ways that work for me and with the supports I have available to me, which could be supportive others or other types of kind of environments. We want to be sure we as clinicians know ourselves and understand our own perspectives and belief, and engage in that self-reflection of kind of understanding our own possible inherent biases and how that might be impacting our work with the person who is seeking therapy. So that ongoing self-reflection, being a part of consultation and discussion groups like this, self-checks and continued learning, using tools like the implicit association test, a task, or kind of consultation with others can really help us to sort of examine our own role in the supports that we are trying to establish. And also, it's certainly important, of course, to recognize that our clients with intellectual disability are not only defined by their disability. Each person that we work with brings experiences related to their race, their language, their gender, socioeconomic status, education level, geographic region. They have many, many aspects to their identity and may experience multiple types of marginalization. And so it's important to know that it's important to explore and engage and understand those identities with people who are seeking therapy as part of that process. So thinking about for that person that I'm working with, how am I supporting their disability identity formulation as part of their broader cultural formulation. And APA offers a really great resource in the cultural formulation interview, which, if you're not familiar with using, could be a helpful tool as you seek to provide that sort of support within the therapy context. I will pause there as we are getting to the end of our time, but those were just a few suggestions that we're wanting to share with you from our perspective and what we understand um, from our practice and our research around supporting self-determination in the therapy context. And I think we'll look forward now to talking about applying some of these ideas to the case study that we have for us.
Great. Thank you so much. I want to thank both of our presenters, Jessica, Richard, for sharing all of that information about this. I want to invite our community members to share some questions that they might have for you that came up during that discussion. And while people are thinking about questions they might have, feel free to unmute and interject or use the chat if you like. As I'm listening to this information about self-determination and self-advocacy, I think therapeutic environments really lend themselves to these types of skills because when we think about self-determination, starting with the building blocks of goal setting skills as an essential part of therapy, I think moving to the psychological empowerment piece of self-determination then is where the rubber meets the road, so to speak. I mean, we also know that goal setting, really needs to be specific and measurable, have a due date, and there's also research that says that writing down your goals can even improve the effectiveness of your goal setting. Have you worked with clients where you did use any accommodations like vision boards or some other form of goal setting that worked well for them?
Jessica, have you worked with clients that used vision boards?
Not vision boards necessarily specifically, but sometimes like Pinterest boards with different like inspiration or different things kind of
Yeah.
achieve like, interests, pursuits, those sorts of things. Sometimes I will also ask folks to, if you're for more artfully inclined people or people who are up for a sketch to draw like a strength self-portrait. So who am I? What are the strengths that I bring to the table? What are
Yeah.
my interests? I love the idea of having like a concrete like vision board type of tool that could be shared in an environment though too. And
Yes.
certainly writing down what is it that I want to have happen and posting that somewhere or recording um recording themselves kind of stating out loud what it is that I want to be doing and where I want to be or what I want to accomplish. Certainly. We've also used it as part of thinking about like I've worked with folks who like might have like an employment goal, like a professional development plan at work or something, and I'm setting what is my goal that I want to have in my job setting. Will let me think about what I might take from what we've been doing in therapy and apply it there, and sort of thinking about kind of the crossover of the work that we're doing in therapy that might also apply for the
Yeah.
personal setting.
We had a chat come through here from Patrick. I'm happy to read it out, Patrick, unless you'd like to share your thoughts. Um, who Patrick says, I attempt to promote self-determination with clients, and simultaneously I attempt to emphasize that having self-determination, it says, does mean you will meet or easily meet your goals. I think it's the negative, right? It doesn't mean just because you have self-determination doesn't mean that you'll meet or even easily meet this. How would you address that issue through encouragement and repetition, other strategies that you
I
might?
mean, yeah, self-determination takes practice, and sometimes you set a goal and you don't meet that goal, and that is okay for you. That is really that happens, and it's really about just recognizing that sometimes we fail. I mean, I remember one time we I decided, and Andrea's going to make a little face at me, but I decided to take 6 graduate level, doctorate level classes in one semester. That did not go well. And and and, but I learned from it. I moved on. We learn by making mistakes, making failures, and stuff like that. And it's like I think CLP is a great way to find out. Of It's a great way to just try out new ideas and new mistakes. Yeah,
Yeah, I really appreciate that. It's a quite a mentorship approach to that therapeutic relationship. And, another aspect of goal setting is to make it realistic. But I also like your framing of learning through failure.
yeah.
And that's part of, overcoming that persistence and determination. It's kind of within the concept. Jessica?
I was just going to add to that. I do a lot of cognitive behavioral therapy, and so I think about the strengths or the strength of an approach where you can develop cognitive flexibility or adaptability in different situations. And I think following this sort of goal setting, um, action planning, and then self-evaluation process really lends itself to that building those cognitive flexibility types of skills and that adaptability to reflect and go, well, how did that go? Oh, well, it didn't go how I wanted it to, but what have I learned and what can I apply differently? And I've tried to really encourage in conversations that I have with clients around this sort of thing is that it's not our success is not defined by whether or not you achieve that goal. What we want to know is, do you feel stronger? Do you feel more confident in your ability to navigate things and to work through challenges than maybe you did before we started? Because challenges will happen, right? We will have things that do not go as we want to in our life, but how we can respond to them and how we can like adapt in the face of them is really what helps us to feel more confident and competent, and then our well-being, I think, is enhanced in doing it too. So
Yeah, thank you for those thoughts. Let's take one last question from the community. Anastasia, I see your hand is raised.
Yeah, I'm kind of struggling to articulate my question, but this is it. So I do a lot of treatment with people that have PTSD, and avoidance is a huge, a huge thing that perpetuates that disorder. And sometimes, initially, when I'm working with a patient, their self-determination is maybe a little bit at odds with, having to approach things that their brain is telling them, oh no, you definitely need to avoid that. So I'm just curious about experience or insight that you would have in working with avoidance and self-determination.
I think that's such a good question. And Jessica, I'm gonna need help. I'm gonna need help from you. I mean, I've done a lot of work with women in domestic violence situations and recovering from PTSD, and it's like, it's a very delicate balance because I think you have to really work on the relationship, but you also need to figure out when you need to push some, some someone. Um, Jessica, what do you think about this?
I think about I appreciate the question so much. There's lots to think about with your question. Um, I think about kind of going back to what is the person's goal, and um, if their goal does involve sort of like kind of pushing or processing through an experience that was certainly very difficult. I think if the person is wanting to move towards that goal, we can talk about what's the pace at which we pursue that. What are the steps that we can move through to help us to help us and help me help you support you as the client in getting where it is that you want to go, and how you get there and the pace
Yeah,
that you get there is sort of is up to you. And so I think thinking that there's a lot to think about with that question, but I think those are some of the kind of initial that I would add to what you shared, Richard.
yeah, and it's like let them set the pace and stuff like that.
I appreciate what both of you are saying so much, right? So we still stick to what we know as evidence-based practice and treating. The therapist is still the therapist driving that content.
Mm-hmm.
But like you said, Richard, the pace and reminding what the goals are, right? Like there's so many ways to provide lots of, increments of self-determination in there while still kind of sticking to the science. Whereas, some folks may think, oh, we just let them drive everything. It's that
Yeah,
partnership, right?
I
Yeah.
mean, I don't know, I don't know. So going back to my domestic violence days, I don't do this work anymore. But some some sometimes it's so hard for people to to leave and it's like not ready to make not not it's like it would be very easy to say, oh, this person's doing this to you, you should just leave and tell them what to do. And that is hard. But what you have to do is really let the client make the choice. And it's like, and you don't want to take power away from them and stuff like that. I don't know if that makes any sense at all. But yeah,
Well, yeah, I mean, even circling back to what you had mentioned, Justin agrees in the chat that it's trying to navigate pushing a little with the avoidance and wanting to respect self-determination is a delicate balance. So I appreciate everybody's insights on how to do this. I see Ashley has her hand raised, and then Christine.
Can
Ashley,
can everybody hear me?
yes.
Okay, sorry, making sure I had my earbuds and I couldn't say. As someone who survived domestic violence and child abuse, what Richard and everybody saying is very key. But for me, as someone who left a domestic violence relationship, it took me wanting to not. I was tired of the relationship, but also I grew up in that household with parents. I'm not going to go into details what my parents' relationship was, but end of the day, I grew up with a generational cycle with parents in a relationship. My mom was able to leave my dad and got out of that, and she's in a much better situation. But you add in the person with a disability, you already got the complex of trauma, a form of, it could be abuse, as in domestic violence, child abuse, whatever the case may be, and mental health. Baby steps, and maybe not do baby steps pushing, because some people might need push all the way. Some might need a little hold your hand along the way to get through it. But for me, I was very fortunate to have a supportive family and the family that knew what I needed. Not everybody is fortunate as me to have a supportive family, just on a beck and call them, tell what's going on. Unfortunately, domestic violence and child abuse is very relevant in this community, but it's not always not documented. It's documented, but it's not as obviously shown, because when you think of domestic violence, it's women that are typically developing that don't have the ID or DD diagnosis.
Thanks for sharing that, Ashley. We appreciate that perspective. Christine, you have your hand raised, and then I know I see Rebecca shared something in the chat. If I might invite you
Well,
to speak more to that. Go ahead, Christine.
I just wanted to say that I put in the chat the supported decision-making bill. It's almost to the governor, not quite. It still has about 2 parts in the Ohio House of Representatives, but the Ohio Senate totally voted for it. So we're just gonna watch out and see. But once that ever gets voted on, everyone's gonna have to get trained on it so they know to try to go for the least restrictive and number one of all. If don't try to tell the parent they need to take guardianship at 18, because that's number one. It's because and because just because somebody's not smart enough at dealing with their finances doesn't mean they need guardianship of finance. That's where a payee is the alternative. So I just wanted to point that out, that it's getting close. Okay.
Well, great. Thanks, Christine, for sharing that policy update and its implications on alternatives to guardianship. And certainly that leads back to, Ashley's point about whether or not there's family to be involved. But, importantly, that is an aspect of support persons and teamwork that can work through all of these issues that we've been discussing. And Rebecca followed up as well with some additional information on the acceptance and commitment therapy comment that she made. Recognizing our time, I want to push us along. I appreciate the rich discussion that we had. I want to thank our presenters again. Thank you so much, Dr. Chapman, Dr. Shuttler, for that presentation.